So CTO PCI or CTO angioplasty is significantly different from routine angioplasties done routinely in cardiac cath lab. So the major difference comes in planning. So CTO procedure needs an immense planning. So operator has to spend good amount of time on angiogram and have a plan A, plan B, plan C, plan D. So you have to check out all these plans before entering into procedure. So if plan A fails, plan B, and B fails C, and C fails D. And also another important thing is, every plan which we do serially should keep your next plan also live, so it shouldn't kill the next plan. So that's how we plan these procedures. And there is a methodology, like we can do antegradally, we can do retrogradally, and we can do a combination of antegrade retrograde. So there are various steps which we have to plan in advance and do it, and all these steps are generally not required in a regular angioplasty. And also complication rates of CTO PCI are slightly more than normal PCI. So operator has to keep all these complications in mind, and he has to minimize the complications and maximize his success to get a good outcomes these interventions. So routinely it takes around 2 to 3 hours for these interventions, and sometimes maybe it might take a bit longer time as well. And one more important thing in these procedures is, apart from regular procedure related things, and time and the contrast used during procedure also is very important to decide where to stop. So when we are not able to succeed in these kind of interventions, these are the limiting factors based on which we decide okay, now enough is enough, we have to stop and do this procedure later on. In such situations, there are certain methodologies which we follow regularly, like doing some intervention to overcome the future problems. So that is known as we call it as some investment procedure. So we do certain investment measures in this procedure, so that my next procedure on the patient becomes much easier and much simpler. So that's another step which we generally take. So this is how CTO PCI differs from a regular angioplasty, which won't contain many steps, and which won't contain plan A, plan B, plan C. Yeah.